A 68-year-old retired engineer went to bed one Tuesday night feeling perfectly fine. He had eaten dinner with his wife, watched the evening news, taken his blood pressure medication, and climbed into bed at his usual time. He did what he always did before sleep, the same habit he had practiced every night for the past 30 years. By 4 a.m, he was gone. His wife found him unresponsive beside her when she woke at 6. The paramedics pronounced him dead on arrival. The cause of death was listed as sudden cardiac death, a massive heart attack that struck while he slept. What his family did not know, what most people do not know, is that the habit this man practiced every single night before bed dramatically increased his risk of exactly this outcome. And millions of people are doing the same thing right now, tonight, without any idea of the danger. The habit I'm talking about is eating a large, heavy meal within 2 to 3 hours of going to sleep. This may sound mundane, it may even sound ridiculous. How could eating dinner late cause a heart attack? But the physiological cascade triggered by a large meal consumed close to bedtime creates a perfect storm of cardiovascular stress that can overwhelm a vulnerable heart. And after 60, when the heart is already dealing with decades of wear, accumulated plaque, stiffened arteries, and diminished reserves, this nightly stress can be the trigger that pushes the system past its breaking point. Let me explain the science, because once you understand what happens inside your body, when you eat a heavy meal and lie down shortly afterward, you will never look at late-night eating the same way again. When you eat a large meal, your body diverts a massive amount of blood flow to the digestive system. The stomach, small intestine, liver, and pancreas all require increased blood supply to process, absorb, and metabolize the food you have consumed. This diversion of blood to the gut reduces the blood available to other organs, including the heart. In medical terms, this is called postprandial redistribution. And in a healthy person with elastic arteries and a strong heart, the cardiovascular system adjusts without difficulty. But in an older adult with coronary artery disease, plaque buildup that has narrowed the arteries supplying blood to the heart muscle, this redistribution can create a critical supply-demand mismatch. The heart needs a certain amount of blood flow to maintain its function. When blood is diverted to the digestive system, the coronary arteries may not be able to deliver enough blood to the heart muscle, particularly if those arteries are already significantly narrowed. The result is myocardial ischemia, inadequate blood supply to the heart, which can trigger chest pain, dangerous arrhythmias, or in severe cases, a heart attack. Now add the lying down component. When you lie flat after eating, several things happen simultaneously. First, the stomach contents press upward against the diaphragm, which reduces the space available for the lungs to expand and can increase the workload on the heart. Second, gravity no longer assists with digestive movement, causing food to remain in the stomach longer and prolonging the period of increased digestive blood demand. Third, the horizontal position causes blood to redistribute from the extremities back into the central circulation, increasing the volume of blood returning to the heart and raising cardiac filling pressure. For a heart that is already stressed by the demands of digestion, this additional volume load can be the tipping point. The left ventricle, already struggling to pump against narrowed coronary arteries and elevated systemic pressure, becomes overwhelmed. The heart muscle, deprived of adequate oxygen by compromised coronary blood flow and burdened by increased filling pressure, begins to falter. Electrical instability develops. And in the most tragic scenario, a fatal arrhythmia, ventricular fibrillation, occurs, stopping the heart entirely. The relationship between late-night eating and cardiovascular events is not theoretical. Research published in the European Journal of Preventive Cardiology found that individuals who ate dinner within 2 hours of bedtime had significantly higher nighttime blood pressure compared to those who ate earlier. Elevated nighttime blood pressure, a condition called non-dipping, is an independent risk factor for heart attack, stroke, and cardiovascular death. A study from the American Heart Association found that late evening caloric intake was associated with higher cardiovascular disease risk, independent of total daily caloric intake and diet quality. But it is not just the timing of eating that matters. It is what you eat. Large, high-fat, high-sodium meals are particularly dangerous before bed because they place the greatest demand on the cardiovascular system. Fat takes longer to digest than protein or carbohydrates, prolonging the period of digestive blood diversion. Sodium causes fluid retention, increasing blood volume and raising blood pressure. And the combination of high fat and high sodium, common in restaurant meals, takeout food, and many comfort food favorites, creates maximum cardiovascular stress at the worst possible time. Acid reflux is another critical component of this equation. When you eat a large meal and lie down, stomach acid travels upward into the esophagus, a condition known as gastroesophageal reflux. This is more than just heartburn. Research has demonstrated that acid reflux can trigger vagal nerve reflexes that directly affect heart rhythm. The vagus nerve, which runs from the brainstem through the chest alongside the esophagus, can be stimulated by esophageal acid exposure, causing bradycardia, dangerous slowing of the heart rate, or triggering atrial fibrillation, an irregular heart rhythm that significantly increases stroke risk. The connection between acid reflux and cardiac arrhythmias is well documented in the medical literature. Patients with gastroesophageal reflux disease have been shown to have higher rates of atrial fibrillation compared to the general population, and treatment of reflux with acid-suppressing medications has been associated with reduced arrhythmia burden in some studies. Eating a large meal late at night and then lying down is the single most reliable way to provoke acid reflux. And with it, the potential for reflex-mediated cardiac arrhythmias. Sleep apnea adds yet another layer of danger to this scenario: obstructive sleep apnea, which affects an estimated 30 to 50% of adults over 60, causes repeated episodes of airway collapse during sleep, producing drops in blood oxygen levels, surges in blood pressure, and spikes in sympathetic nervous system activation. These physiological stresses are most severe during the deepest stages of sleep, which typically occur in the first few hours after falling asleep, precisely when the cardiovascular system is also dealing with the metabolic demands of digesting a recently consumed meal. The combination of sleep apnea and late-night eating creates overlapping cardiovascular stresses that compound each other's danger. Blood sugar is another piece of this puzzle. A large meal consumed before bed causes a significant spike in blood glucose, which triggers a correspondingly large insulin response. In a person with insulin resistance or diabetes, conditions that affect approximately half of all adults over 60, this glucose spike and insulin surge can cause reactive hypoglycemia during the night, when blood sugar drops below normal levels several hours after the meal. Nocturnal hypoglycemia is associated with cardiac arrhythmias, prolonged QT interval, and sudden cardiac death. It is one of the proposed mechanisms for the phenomenon known as dead-in-bed syndrome, which primarily affects diabetic patients who die unexpectedly during sleep. The solution is remarkably simple, and it can significantly reduce your cardiovascular risk. Finish your last substantial meal at least 3 to 4 hours before bedtime. This does not mean you have to go to bed hungry. A small light snack, a handful of nuts, a piece of fruit, a small portion of yogurt, consumed an hour before bed is unlikely to cause significant cardiovascular stress. The danger lies in large, heavy meals that demand major digestive blood flow redistribution, provoke acid reflux, spike blood sugar, and increase blood pressure, all while you lie horizontal and unconscious, unable to respond to warning symptoms. If you currently eat dinner at 7 or 8 in the evening and go to bed at 9 or 10, consider shifting your dinner earlier to 5 or 6 o'clock. This gives your body 3 to 4 hours to complete the most metabolically demanding phase of digestion before you lie down. If your schedule does not permit an early dinner, eat a lighter evening meal and save larger meals for earlier in the day when your cardiovascular system can handle the metabolic load while you are upright and active. The composition of your evening meal matters as well. Choose foods that are lower in fat, lower in sodium, and moderate in portion size. Lean proteins, vegetables, and whole grains are easier on the cardiovascular system than fried foods, red meat, cheese-heavy dishes, and processed foods loaded with sodium. Avoid alcohol with dinner when possible. Alcohol relaxes the lower esophageal sphincter, worsening reflux, and it disrupts sleep architecture, reducing the restorative deep sleep that your cardiovascular system depends on for overnight recovery. Elevating the head of your bed by 6 to 8 inches, using bed risers or a wedge pillow, can reduce acid reflux and improve cardiac hemodynamics during sleep. This position allows gravity to keep stomach contents in the stomach and reduces the volume of blood returning to the heart compared to lying completely flat. If you have been diagnosed with coronary artery disease, heart failure, diabetes, or sleep apnea, the recommendations I've outlined are not optional lifestyle tips. They are medical necessities. Your cardiovascular system is already operating with reduced reserves, and the additional stress of late-night heavy eating may be the factor that tips you from compensated to decompensated, from stable to catastrophic. I want to address the psychological dimension of late-night eating because for many people, the evening meal is the most social, most enjoyable, and most emotionally satisfying part of the day. Asking someone to change this habit is asking them to change something deeply tied to their daily routine, their family dynamics, and their relationship with food. I understand that this is not easy, but I also want you to understand that the stakes are real. The man I described at the beginning of this video is doing something that seems completely harmless: eating dinner and going to bed. He had no idea that this simple habit was placing his heart under dangerous stress every single night. His family had no idea until it was too late. You now have information that he did not have. Use it. Adjust your meal timing, reduce your evening portion sizes, choose lighter foods, and give your body the time it needs to process your food before you lie down. These simple changes cost nothing, require no medication, and can meaningfully reduce your risk of the nighttime cardiovascular catastrophe that claims thousands of lives every year. Share this with every senior you know, especially anyone who eats dinner late, snacks heavily before bed, or has been diagnosed with heart disease, diabetes, or sleep apnea. Subscribe for more critical health content and drop a comment below. Your engagement helps this reach the people who need it most. Protect your heart tonight. It has been protecting you your entire life. The autonomic nervous system plays a crucial role in the nighttime cardiovascular danger of late eating that I want to explain in more detail. Your autonomic nervous system has two branches: the sympathetic branch, which accelerates heart rate and raises blood pressure during activity and stress, and the parasympathetic branch, which slows heart rate and promotes recovery during rest. During healthy sleep, the parasympathetic branch should dominate, allowing the heart to slow down, blood pressure to drop, and the cardiovascular system to recover from the day's demands. This nighttime parasympathetic dominance is essential for cardiovascular health and is one of the primary mechanisms by which adequate sleep protects against heart disease. When you eat a large meal close to bedtime, you disrupt this autonomic balance. Digestion activates the sympathetic nervous system, raising heart rate and blood pressure at precisely the time when your body should be shifting into parasympathetic recovery mode. This sympathetic activation persists for hours after a large meal and competes directly with the restorative parasympathetic activity that sleep is supposed to provide. The result is a night of elevated heart rate, elevated blood pressure, and reduced cardiovascular recovery. Night after night, year after year, compounding into significant cardiovascular damage over time. Inflammation is another pathway through which late-night eating increases cardiovascular risk. Eating triggers a transient inflammatory response as the immune system interacts with food components and gut bacteria during digestion. This postprandial inflammation produces measurable increases in circulating inflammatory markers, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha. In a healthy individual eating during daytime hours, these inflammatory spikes resolve quickly and do not cause lasting damage. But when eating occurs close to bedtime, the inflammatory response overlaps with the sleep period, during which the body normally engages in anti-inflammatory repair processes. The competition between pro-inflammatory digestion and anti-inflammatory sleep recovery creates a state of chronic low-grade inflammation that accelerates atherosclerosis, destabilizes arterial plaque, and increases the risk of plaque rupture and heart attack. The relationship between late-night eating and blood clotting adds yet another dimension to this cardiovascular threat. Blood coagulability, the tendency of blood to form clots, follows a circadian rhythm, with the highest clotting tendency occurring in the early morning hours between approximately 4 and 8 a.m. Morning. This is one of the reasons heart attacks and strokes are most common during this time window. Late-night eating can amplify this early morning clotting tendency through several mechanisms. High-fat meals increase the concentration of clotting factors in the blood for up to 8 hours after consumption. High carbohydrate meals produce insulin surges that increase plasminogen activator inhibitor 1, a molecule that suppresses the body's natural clot-dissolving mechanisms, and the dehydration that occurs during sleep, when fluid intake ceases for 7 to 8 hours, further increases blood viscosity and clotting tendency. When these meal-induced clotting effects overlap with the natural morning peak in coagulability, the combined effect can create conditions favourable for the formation of the coronary artery clot that causes a heart attack. Weight gain from late-night eating contributes to long-term cardiovascular risk through mechanisms beyond simple caloric excess. Research has demonstrated that calories consumed in the evening and at night are more likely to be stored as fat compared to the same number of calories consumed earlier in the day. This difference is driven by circadian variations in insulin sensitivity, metabolic rate, and fat storage hormones. Evening and nighttime insulin sensitivity is lower, meaning the body produces more insulin to handle the same glucose load, and higher insulin levels promote fat storage. Additionally, the thermic effect of food, the energy expended in digesting and processing food, is lower in the evening, meaning fewer calories are burned during late-night digestion. Over time, the excess fat storage from habitual late-night eating contributes to visceral adiposity, fat accumulation around the abdominal organs, which is one of the strongest risk factors for cardiovascular disease, type 2 diabetes, and metabolic syndrome. Practical strategies for breaking the late-night eating habit deserve attention because knowledge of the risks alone is often insufficient to change deeply ingrained behaviour patterns. If you currently eat dinner late because of work schedules, social commitments, or personal preference, consider shifting your largest meal to midday and eating a smaller, lighter dinner in the early evening. Meal planning and preparation earlier in the day can remove the convenience factor that often drives late-night eating. Staying adequately hydrated throughout the day reduces the hunger signals that can drive evening snacking. And establishing a consistent evening routine that replaces food-related activities, reading, light stretching, meditation, or a short walk, can break the behavioural loop that connects nighttime with eating. If you find yourself consistently hungry before bed despite eating an adequate dinner, evaluate whether your daytime nutrition is sufficient. Skipping meals during the day or chronic undereating often leads to compensatory overeating in the evening, creating a cycle that is both metabolically harmful and difficult to break. The concept of chrononutrition, the science of when you eat, not just what you eat, is an emerging field that provides additional context for understanding why meal timing matters for cardiovascular health. Research has demonstrated that the body's metabolic responses to food vary dramatically throughout the day due to circadian rhythms in hormone secretion, enzyme activity, and organ function. The pancreas produces insulin more efficiently in the morning and early afternoon, when insulin sensitivity peaks. The liver processes fat more effectively during daylight hours, when metabolic enzymes are most active. And the gut microbiome follows its own circadian patterns that influence nutrient absorption, inflammation, and metabolic waste production. Eating at night disrupts these circadian metabolic rhythms, forcing organs to process food during their natural rest period. This circadian disruption has been shown in multiple studies to increase markers of cardiovascular risk, including elevated triglycerides, impaired glucose tolerance, increased inflammatory markers, and elevated blood pressure. The chrononutrition research strongly supports the recommendation to consume the majority of daily calories during the first half of the day and to minimize food intake in the evening hours. The specific risks for diabetic patients who eat late deserve dedicated attention because diabetes and cardiovascular disease are so closely intertwined. Approximately 70% of people with diabetes will ultimately die of cardiovascular disease, making anything that increases cardiovascular stress in diabetic patients particularly dangerous. Late-night eating in diabetics causes pronounced blood sugar spikes that are difficult to control because insulin sensitivity is at its lowest point in the evening and overnight hours. These hyperglycemic episodes damage the endothelial cells lining blood vessels, promote inflammation, and increase the production of reactive oxygen species that accelerate atherosclerosis. For diabetic patients on insulin or sulfonylurea medications, the insulin required to cover a late-night meal can cause dangerous nocturnal hypoglycemia several hours later, when blood sugar plummets during sleep. The combination of evening hyperglycemia followed by overnight hypoglycemia creates a metabolic roller coaster that is profoundly stressful to the cardiovascular system and significantly increases the risk of nighttime cardiac events. The role of the gut microbiome in late-night eating cardiovascular risk is an area of rapidly expanding research that adds yet another dimension to this discussion. Your gut contains trillions of bacteria that play essential roles in digestion, immune function, and metabolic regulation. These bacteria follow their own circadian rhythms, with different bacterial populations being more or less active at different times of day. When you eat late at night, you deliver nutrients to the gut at a time when the microbial community is not optimally configured for processing them. Research published in the journal Cell has demonstrated that disrupting the circadian feeding pattern alters the composition of the gut microbiome in ways that promote inflammation, increase intestinal permeability, sometimes called leaky gut, and enhance the production of trimethylamine N oxide, a metabolite that has been strongly linked to atherosclerosis and cardiovascular events. These microbiome-mediated effects of late-night eating operate on a longer timescale than the acute hemodynamic and metabolic effects I described earlier, but they contribute to the cumulative cardiovascular damage that makes habitual late-night eating such a significant risk factor for heart attack and stroke over time.